A demand letter in our opposition addressed to the Pharmacy and Poisons Board and copied to the Director of Medical Services has damning revelations. The letter from the law firm of lawyer Gitobwe Manyara, a seasoned legislator on behalf of his client AqriQ Quest Limited, seeks 13 million shillings in outstanding dues from the Ministry of Health. On the 17th of December 2014, at the height of the vaccines controversy, when the Catholic Church called for a boycott of the tetanus and polio mass vaccination exercise, the Pharmacy and Poisons Board wrote to AqriQ Quest requesting for cost of analysis of the tetanus vaccine and the turnaround time. On the 8th of January 2015, the Director of Medical Services, then Dr. Nicholas Muraguri, wrote two more letters to the lab, one asking for the availability of the matching tetanus vaccine vials and the other submitting 40 vials for analysis. 2 days later, a draft report was presented to a joint committee of experts. However, the final report could not be tabled before the same committee. Only the Catholic Health Commission received it. This, according to the demand letter, after several attempts to have it tabled before the committee failed. The letter goes on to reveal the reason why the Ministry of Health was not keen in receiving the report. It indicates that the analysis found the vial submitted for testing as batch number 019L3001C to have been contaminated. The Ministry of Health, according to the letter, then instructed the lab to alter the results to reflect that the vaccines were safe to be administered. The government's reaction was to deny the laboratory payment for refusing to alter the results, but the lab was adamant. The letter then indicates that the Pharmacy and Poisons Board wrote to them asking them to revise their cost downwards to 600,000 Kenyan shillings if they wanted to be paid, even though a previous invoice of 5.7 million shillings was fully settled by the government. AqriQ Quest Limited is demanding 13,798,200 shillings. Failure to pay will result into a lawsuit. The vaccine in question was declared as safe by the government, UNICEF and the World Health Organization. However, the Catholic Church felt something was not right, even calling for a boycott. On the 14th of January 2015, a statement signed by bishops insisted that no further mass tetanus vaccination campaigns should take place in the country until the vaccines have been appropriately tested and proven to be safe.
Should this not be done, we, the Catholic bishops in Kenya, are asking all Kenyans not to participate in this exercise until such a time that the manufacturer's directory documents have been produced.
In February 2015, the Catholic Church claimed that at least 500,000 women might not be able to bear children after being injected with the contaminated tetanus vaccines containing the anti-pregnancy hormones. The World Health Organization and UNICEF dismissed what they termed as, quote, grave allegations, end of quote, saying they were not backed by any evidence. The government has also denied that the vaccination program is a secret mass sterilization effort. AqriQ Quest Limited was not the first to conduct a test on the tetanus vaccine vials. At the request of the bishops, the tests were done in 5 different laboratories in the country. The Ministry of Health at that time rejected the results, citing poor methodology. That was the time the decision was made to conduct the tests outside the country. Ken Mijungu, NTV.